compare the results that I used to have to what I have now. And so, so a little bit about us. Our credo here is, the Williams Center taking care of each other and you. So we're going to talk about, what is it that drives us? What's a deep plane? And what's a consultation? It's a little intimidating for people. Like, what do I do? Like, this is embarrassing. I don't want to talk to people. But Sarah and Nicole have been here for a number of years. Sarah was a nurse. They are extremely experienced and could almost finish half of my sentences. We've been together so long, which is cool because they can really help patients out. And then, Shelly was kind enough to come here and share her experience. And then we just got, and I actually got some giveaways, and just, we respect your time. We appreciate people to take time. So people always just want to know credentials. I'm kind of an upstate person. I had a lot of opportunity in Chicago and maybe in New York and in Boston, but this was home for me. I did my medical school in Buffalo, did my undergrad at Cornell, had neck surgery in Syracuse, and I did my fellowship in Chicago. But I came back to here, didn't know a soul. I just wanted to be back in the Northeast. I wanted to be near Vermont in the mountains and be able to get to New York and Boston. And there was a university here, so I'm a clinical professor at Albany Med. I wanted to teach residents, and we now have 2 fellows who train with us every year. And now I'm chairman of the clinical advisory board of Alpha Step Partners. So we have put together a group of med spas around the country, which are best in class. We're very, very selective, and we're trying to set the bar as high as possible in the non-surgical. I mean, if you just look around at what's popped up here, okay, and you look at some of these people who look kind of funny, we're trying to set the bar really high as far as quality. We're putting training protocols together. We're a clinical research center here. So, yeah, I've been doing this for a long time, and people always ask me, how do you, and there isn't anything I haven't seen in a facelift. I can say that now. I've done it all. And so, to me, that experience matters. I feel like I'm at the top of my game, and it's all I really do now. I do I've only done facial plastic surgery my entire career, but really focused primarily on facelift surgery. So who are just a little bit about me. That's my wife, Sherry, in the upper right-hand corner with me, probably somewhere in a boat. And my family here. So, years ago, maybe I was foolish, and but I actually put this facility in when I was 38 years old. Because I had this vision of building a destination practice before it was kind of popular. And I figured, we're by the airport, and I had patients flying today from Atlanta. I did a facelift on a guy from Wisconsin Tuesday. So it's happening. And it's pretty cool when your work gets recognized. And I think some of it is because the world has become smaller with the internet. I put a lot of teaching YouTube videos out there. If you watch them, I'm very honest, and people pick up on that. They can tell who's experienced. So our motto here is taking care of each other and you. And I can tell you story after story after story of how our people have really chinned to the bar, take care of our patients, but each other. When someone's down, someone's got a family problem, they're here for each other. And I think our patients can feel that. And so we're really here, and this is part of the Alpha, best in class. Our network, but it's what we try to do here. We want to be best in class, and I just believe, I don't care how competitive the market is, if you're the best, people figure that out. They know. One thing that I'm really proud of is we have a world-class ambulatory surgery center here. All of our surgery is done right in this facility. Has been for 28 years, something like that. 1997 I put the facility, 97, 98. We've been through every 3 years. We're accredited by the state and federal government. So we're a Medicare-approved facility every 3 years. So I think we're on our 10th round of accreditation now, every 3 years. So it's something I'm very proud of. And the thing is, with the Ambulatory Surgery Center, it's at the highest standards, same standards of care we get in the hospital. So, and people ask me, well, what if you have a problem here? If you go down there, you look at our videos, you can see it's a real surgery center. But I have a transfer arrangement with Albany Med because I'm on faculty there. In 28 years, I've never had to transfer a patient there. So, but we don't take chances, and I think that's really important because people worry about having surgery in the office somewhere. It really is a surgery center. So, again, we've recently had our accreditation. It's very private. What I like too is our nursing team downstairs in the operating room. It's not only specialized in plastic surgery, but it's one-on-one care. So When you're in the recovery room down there, you got one nurse, and they're with you. They're not taking care of sick people. And it's a standard that we've been able to set. You know, we're not in a facility where, you know, we're understaffed. And I think you people who've been through here feel that. I mean, you feel the care when you're here. People take care of you. So this is just a little video of our surgery center. I actually did this video during COVID because people are worried, right? I'm going to have surgery, so we still have the same standards of care, safety that we have in the hospital. But I really didn't feel that the hospital was serving our patients in a very private setting as well as we could do if we had control of that. So we went through the AAAC accreditation agency, which is also Medicare approved and inspected by the New York State. It is a fully compliant facility that has backups for everything. Backup generators.
It's just like flying a plane. There's a backup for
25 air changes an hour with 5 fresh air changes. I'm proud of the fact that I've never had to transfer a patient to the hospital, but we have transfer arrangements and all of those things that comply to the highest standards of care. The team that I work with is kind of like an orchestra. When I'm doing a surgical procedure, I literally put out my hand and my scrub tech has been with me for 20 years, knows what instrument I need. And that's a huge advantage. As a surgeon, it's also a huge advantage to the patient because we're getting the same team every single day. So consistency of care, privacy, and safety is there and is unparalleled in what I am able to have in the hospital. We basically take care of one patient at a time, and they get one-on-one specialized care with specialized trained nursing, and our whole anesthesia team is dedicated to the cosmetic patient. One of the other advantages of having a fully accredited ambulatory surgery center that's just dedicated and special.
Enough of that. So I put this video together a few years ago because there was so much confusion around, like, what is a deep plane? Why do a deep plane versus not a deep plane? I'm going to show you this video. This video has a lot of, how many views does this video have online?
Over 90,000.
It's crazy. It's crazy. But we put this together as a teaching video. But this explains, because I have these like videos that I do like live surgery for teaching surgeons, but it's graphic, and the average person doesn't want to see all that. But it's also hard to see. Like, you don't know the tissue planes. So this is a little video we put together. I think it's really pretty good. Obviously, the internet likes it. Here, this represents the skin, okay? And underneath it, you've heard this word SMAS. That's the submuscular aponeurotic system. And that is a layer that is contiguous with the platysma, the muscle in your neck, and up here in the temporal parietal area. But basically, this is the fascial layer that we work on. Now, on the skin surface, you see a jowl, and you see some deepening of this nasolabial fold. So when we do the surgery, the traditional surgery, you lift up the flap, you see. Actually, the older facelift surgery is just pull the skin. But as you can see, with this wrinkle in the underlying SMAS, just pulling the skin tight is not going to give an effective elimination of that. You can still see that lump in there, just like having a pillow in a bed, right? So I'm going to pull this over here. Let's assume when we're doing surgery, we are reflecting this. The most common technique used in the country is what's called an imbrication technique. And what that means is we take a little strip out of this SMAS, and then we tighten it a little bit, and then we lay that back down and we lay the skin down. So I'm going to show you what that looks like and why that's different from a true deep plane. And I'm going to go ahead and just demonstrate this by taking a little strip of the SMAS out. I'm going to get a hold of it here. Okay, and so here I'm taking this strip out. Dr. Rose and my fellow is laughing. Watch.
I got Dr. Rose over here chuckling. Just like the church, you know, we're not supposed to laugh, right? All right. So we're taking our strip out of the SMAS. And this is, again, probably the most common way to do a facelift.
Just as a SMAS lift
in the country.
You'll hear it, SMAS.
So this is called an imbrication.
And this is what I did for years.
Imbrication. Now, you can see that you can actually tighten this SMAS up, okay? You can tighten this SMAS up a little bit, but the problem with it is there's resistance on where the ligaments are,
And when you pull the skin back, you're still going to have a little bit of a lump, okay? It's not as effective, I should say. There are people saying they're doing the deep plane lift, and what they're actually doing is they're kind of going into here and they're spreading, okay, they're spreading this tissue to try to release this a little bit. But a true deep plane facelift, and I'm going to show you this, carries this dissection further up here, okay, and cuts these little ligaments. And I'm going to show you something. When we cut these ligaments, okay, all these little ligaments here, and cut these little ligaments here in the face, and take this down further into the neck, which is what we do now with our deep plane lift. I want to show you something. Look what happens to this mass. Okay? Now we trim this all.
Trim and
Look what
reattach.
happens
What do you use? It just
to the jowl, and more importantly, look what happens to that jawline. Okay? So it restores tension in this direction, but more importantly, you get all of the tension on this mass, repositioning things back where they should be, because this mass is what stretches out. We trim this. I'm not going to bother to show you all that right now in the interest of time, but then the skin really redrapes, and it's a much more youthful jawline. It softens its fold and addresses the mid-face. So I hope that's given you a little bit of an understanding as to what a true.
So people ask me, why, that's the only lift you do, and the reason why is it is so much more natural. I want you to be very critical of my work and look at the post-op photos and ask yourself, do they look natural? Because when things are done correctly, you can't tell. Okay, so we'll go through it. So people always ask the cost, and Lex, you can talk to you, PCCs can talk a little bit about that after, but there's basically three fees. There's a fee that covers a surgeon fee, and there's a fee for anesthesia, and then there's a fee for the facility. And our patient concierge there's no secret, still tell you exactly what they are if you're interested. So someone's interested, they talk to either Nicole or Sarah, and they'll help you with the journey. Again, we have a lot of people come from out of town. They'll help with hotel rooms and basically work through that process. So it really starts first, though, when I see patients is we do computerized imaging. And what I do is I see the patient. I first look at them. We talk to them in a room, in my consultation room, and I say, listen, I give them a recommendation. Because I want to make sure that we're on the same page. Some people are focusing on their neck when really their eyes are the bigger problem. And so I tell people, look, I'm not here to talk to you anything. I'm here to give you an education. But I like to use priorities. Like if you were to take a step up the ladder, this is going to give you the biggest bang for your buck. Because at the end of the day, I just want a happy patient, and I want to know I delivered value. Because if someone's focused on the wrong thing, and they're not going to get value, then they're not going to be happy, and then I don't have a happy patient. So computerized imaging is great. I won't do surgery on someone unless I image them, because and I won't show them something that I don't think I can get real close to. And if I have a patient like, I see it, absolutely I see it, my chance of having a happy patient is about 100. So I use computerized imaging on everyone, and we can, basically what I'm able to do is show them what I think what they're going to look like afterwards. And it's pretty accurate. People always say, well, when's the right time? There is no right time. Most of my patients are between the ages of 40 and 70 or so, 70, 75. On occasion, I have someone who's 80. They'll say to me, listen, I'm otherwise healthy. I'm not ready to sit on a porch in a rocking chair. And people always say, well, I'm going to do it and I'll never have to do it again. I saw a woman yesterday. Okay, I did her first facelift 30 years ago. I did her second one about 15 years ago. And now she's scheduled for a third. And she's in her late 70s. So, people, and she looks natural. So, but people don't want to just give up on living. So it depends. I have 40, I'll see some people in their late 40s. And they're like, I don't want to wait until I'm looking old. It's bothering me now, and I want to address it now so I can enjoy it. So really there is no right age. What I tell patients, if you got to do it for yourself. I'm not going to tell you should do it. But that's kind of the typical age. Recovery process, so we have eliminated drains.
I did that about 2 years ago. Because this deep plane is in it's in what we call avascular plate. So we eliminate drains. There's a wrap that people have on, and we have videos of all this stuff if people want to see it. And the dressing is removed the next day. So it's kind of a wrap. Sutures are removed in day 8. So that's kind of a recovery period. Most people, I tell them they're disguisable at 10 days to 2 weeks, meaning fuss with your hair a little bit, fuss with your makeup. Most people can go out in public, especially people who wear their hair longer. Most people go out in public about 2 weeks. Okay? If I have to do a lot of liposuction, someone has a full neck, and I'll show you a couple of these patients, it's just more. It takes more. It's more like 3 weeks. Okay. So here's, this woman. This is a day-by-day video, but I'm going to probably skip this because we have a couple other day-by-day videos. But I want you to see a couple things with this. This area here has been put back. This fold has been corrected, and that job, and that looks very natural to me. You would never know she had a lift until you see this. That's what good work looks like. Okay. I'm going to skip her video because I have another one right here, and just in the interest of time. So this woman here is, she's 24 hours post-op. I think she must have had a chemical peel too at the same time, right? Mm-hmm. So she looks, but that's, she had her eyes done too.
The results are what worry. And the recovery is no worse. I mean, you're 1 day out.
So that's 1 day out.
Have you seen your neck yet? No, okay, here we go. Here we go. Check out the jawline now.
Oh, it looks great.
And I know your daughter's a little concerned. She loves you the way you are. But then she looks at these incisions are all beveled.
And we'll show you the incisions, through a period of time because it's in the beginning. There she is, day 6. Starting, and again, it looks very natural to me. Doesn't look overdone.
I am day 8 post-op.
It's day 8. Not terrible.
Everything's coming along quite well, and I'm really excited to see the final result.
Now she had a chemical peel, so she's a little more slow, but here she is, day 9, day 20. That's 3 weeks, okay, so day 41.
Hi, I'm 6 weeks from having a deep clean facelift. Feeling great to say I celebrated my 56th birthday, and to the surprise of my entire family, I didn't look like I was 56.
So there are before and afters. Again, to me, that looks very, very natural, not overdone, not overpulled or tight. But she has a much cleaner, natural-looking jawline. Here's another woman, going all the way out to 7 months. Here she is at day 8, still a little swollen, and here she is. And I think she sent us this photo, for her car. And people tell me too, they're like, I love my face, okay, but I love my neck. I didn't realize this bothered people that much. But the lift that we do now, I get it from here all the way down here. And again, that to me, and it's life-changing for people to, go through it. Where's the incision? Everybody's different, everybody heals differently, but this is what I do with this incision is I actually bevel this at an angle so the hair grows through it. So initially you can see that incision. The incision's pink, but it's not unusual for us to see people back 6 months later. It's really hard to find. So again, it's a process.
I right in the hairline, and I bevel that incision so the hair after the surgery actually grows right through that incision. It makes it almost imperceptible. Then what I do is I come back here and go behind this thing called the tragus, so you really don't see this incision. And then as I come out behind the tragus, I come down in here in this little crease, because we want to get all of this in the neck, actually come right up on the back of the ear here, where you don't see it. Okay. And then I come across at about here, and then I dot right down in the hairline. And the same thing as in the front of the ear. If we bevel this incision here, the hair grows through it, and that's how we make it basically imperceptible. So someone can also wear the hair up in a ponytail and not be able to see that incision.
So here how it starts to fade with time. Okay. So I have been doing, as of recent, what we refer to as a scarless incision. It's not for everybody, but I'm able to completely avoid the incision here and put it back in the hairline. The problem is for people who have a lot going on, or for people who are older, I move enough tissue that I can't do that incision. So it's for a very specific, typically younger patient. Now this woman was 63 in this video. And also they have a little more swelling in the upper face for it. I'll show you that.
Someone who doesn't have a lot going on here, and we're really looking to.
It's just a modification, but it's not for everybody.
And rather than come out here, I actually sneak it in behind the hairline. And it allows me to get all the way down into here, or without having to move out. But it is important to really pick your patients correctly, because if I have someone who has a lot of tissue that's moving here, we can't do that because then you move.
And here's her. And again, she's a little younger, or she's 60, but typically I reserve this for the younger patient. She also had a lip lift. You can see it, she's a little early on. There's a little incision here that hides. But with time, you can see how that's a popular procedure we've been doing. People like the fact that the lip lift, again, you can see, I'll point that out so you can see it, but that incision disappears. I'll show you some other patients. It's really hard to find it. But people who are like, I'm done with filler, I want a natural lip. The thing about the lip lift is very natural. I'll show you a couple other patients. Commonly asked questions, how long is the recovery period? I tell them 3 weeks, no restrictions. But typically, I tell people 10 days, 14. I had a patient yesterday, her daughter's getting married. I tell her 3 months. You're the mother of the bride, there's a lot of attention on you. So that's a difference. So recovery is relative, right? I mean, when can I, be in a Zoom call? Well, a week or two, and people feel fine the next day. Interestingly, patients, and there really is virtually no treatment. We've eliminated narcotics. We basically use a Valium for a day or two. And what people tell me is it just felt tight. Not like choking tight, but it feels tight. There's no question it feels tight for a little bit. So yeah, in public, typically 10 to 14 years. Now this is a younger woman, and just to show her, she's about a month out now. And when you ask her, was it worth it? It's a subtle result, right? You see the jawline, you see this fold, this is flattened down, but you ask her, and I think we got videos of her. She's like, it was the best thing I ever did.
She's on her YouTube channel, so.
Yeah. No, she's like, it was the best thing I ever did. I didn't want to wait, until I started to really, look over. Looks very natural, but you're going from square to more triangular. And that's really, if you go back and forth, you can go back and forth. Naturally, someone who's 48 is not going to 15 years younger. But you'll see some people who are older, and it makes a big difference. So here's a woman who, again, here she is before. We did some fat grafting too, but here she is, 6 weeks with a little makeup on. So typically at about 3 or 4 weeks, people look really good. Here's her photo. Another woman. She actually, this woman came to our last seminar. She was kind enough to come. She had a lip lift as well. Just was kind of tired of, tired of filler. And you can see, if you look closely, I think she's about a month here. You can see there's that incision. But seriously, one of the more favorite procedures we do now are lip lifts, because people who just don't want filler.
A family member, and of course I didn't want to tell anybody, and especially family members, because they can judge. And she just kept looking at me and she said, I don't know what you're doing, but you look amazing. She told me I look better than I did 10 years ago. And I was like, really? She said, yeah, you just look so good. You look so rested and refreshed. You just look so good. And I just told her I was, using good skincare, but it was really nice to see that. It was really nice. And also too, as a woman, you see people turning heads and looking and complimenting you, especially people that it's nice. It gives you affirmation that I did the right thing. I did the right thing.
So there's that patient I showed before. Again, to me, nice clean jawline. Not drastic, but returned that triangular view back here. And the reason, again, I can't get those kind of results without a deep cam. It just can't. And I know because I did the other lift for 20 some odd years. Okay. I think you saw this one woman you saw in the video, but heavier jawline, heavier neck. Again, nothing looks pulled or tight. It's a nice clean jawline. There she is front view. I think we did her upper eyes as well. You can see that.
Tammy, I'm 56. I researched the deep cleaning procedure for approximately a year. I did a lot of research, and Dr. Williams' name kept coming up. I had quite a few people in the Saratoga Springs area that had given his name as a referral. Before the surgery, every time I walked past a mirror, all I could see was just this version of myself that I didn't feel comfortable with, and that was really what was the catalyst that caused me to come in and have this surgery done. Surgery day was very interesting. I really felt like I was going to be really nervous coming into it, and I wasn't. I was very relaxed. The atmosphere was nice. Everybody was extremely friendly.
I think a lot of that is the team downstairs. You know, I mean, if you're going to a big hospital and they're going to run you around, you're not going to get the same thing.
After the surgery, it really wasn't bad, honestly. It was the day after that there was a little bit more of the feeling that it was a little painful. The recovery has been amazing. Again, day 2 I think was the worst of all of it. I took Tylenol, and that was the extent of it. The healing process has been very easy. It was a lot less painful than I really thought it was going to be. Dr. Williams and his team have been amazing. Anytime I had any questions or concerns, I could pick up the phone and call, or I always had that option to come into the office as well and speak to somebody if I had.
And when you call here, you get a live voice. That's another thing that's different, I think. It's always phone patients. This patient made a Williams Center tie. She knows how to wear bow ties, so she put that in. But just a few examples of patients, and again, I think these people look really very natural. They're not 20-year-old. They don't look 20, because that's not what these people want. Just actually that one patient.
Helen, and I am 64 years old. After my surgery, I had to attend an event, I will say, where there were many, many people that I ran into there from my previous job. I was a teacher, so many of my students and my colleagues were at this event. Received many, many compliments, but the best compliment I got is I ran into Dr. Williams, who came right up to me and said, "You look fantastic!" And I said to him, and I'm telling everybody here that I'm speaking to who talks to me, I let them know my surgery.
One of those things you can't control. Anyway. So to me, again, let's go back and forth, the deep plane, right? The jawline, this area you cannot correct without a deep plane, and you cannot correct this area here. And that's why people start looking windswept when things are overdone. These are both physicians that came from up north, so it's always I see more and more physicians these days as patients, so it's always a flattery and an honor, really. So a heavy neck, they're tough, they're tougher, but I can't, another heavy neck, again, a lot more work to get all that back, but it looks natural. She's gone from square to triangular. Freddie is my kid cousin, so we used to ski together when I was in. She probably took me to the bar before I was 18. But she's in Rutland, Vermont, and I joke about it. She's been threatening to get a facelift for about 10 years, and her son's getting married this coming weekend, so she finally did it 6 months ago or so. But anyway, it's wild. I never would have thought many years ago that later I'd be operating on my kid cousin. This is Freddie. I don't need to go through the whole video.
I'm just going to explain a little bit about my journey. I came in and had my deep facelift right here in the Williams Center, and then I went to a motel nearby, and I had a nurse right here stay with me that night, and it was a very comfortable night, and Meg, the nurse, was incredible. She was an angel by my side that night. Not that I really needed one, but it was a real comfort to me.
A lot of our nurses will stay with
I would like to
patients
say
right here.
that-
That's kind of cool. So we recognize this person, right?
Talk about heavy neck.
So I ran into him when he came in. I'm like, look at that. Did you lose the weight? But this is you sent us this photo, right? Where was this from?
I did. That was Daytona, probably about 4 or 5 months after.
Yeah. Well, you look terrific. And you look very natural. And no one would know you had all that done, right? So
So you can ask her some questions after. It was very kind of her to come. This woman had not only a deep lip, but she had a lot of wrinkles, so we did a chemical peel on her at the same time. It does add to the recovery, but I mean, her neck looks terrific. This wrinkling really aged her, so the lift in conjunction with the chemical peel really helped. Chemical peels and laser surgery, that doesn't get every last line of wrinkle, but there's definitely 50-60% improvement. And sometimes we'll do that at the same time. This one was a little older, she's 74, but like I said, I had a lot of patients in their 70s. And
She was out of town too.
What's
She
that?
was out of town.
Yeah, I think she came from
Louisiana
or something, but and she stayed here for a week. Male patient, we had a few men, men are more secretive, so they don't like to share their photos, but we ever share men. Another, heavier neck, jawline, nothing overdone. To me, you could argue, but to me, she looks natural. Same thing here, just a couple of results, and then I'll flip through.
I'm 58 years old. I thought about it for
So it ranges
over
between
4
about
years, and
mid-late 40s to
did
75,
research
80.
for over 2.5 years. And I was ambivalent about doing it because I just wanted to know everything before I made a decision. She had over, I think, 8 or 9 individual consults with different plastic surgeons, all the way from New York City to Boston. And my last consult was with Dr. Williams. And even throughout those other consults, I wasn't even sure if I wanted to go forward with the procedure. But once I came to here and I met him and his staff, I was less confident that this is my decision to have him do the surgery.
She just didn't want to look unnatural. That was her big concern. She did not want to look pulled or tight. And I don't think she does. She looks great. So anyway, I want to thank everyone for taking time. I don't want to talk any longer. I am here, to answer questions.
I had gained even more weight after I had my facelift done, and I was pushing, and I was getting unhealthy, so I decided I'd go on the shot, and I went on the shot, and I lost like 50 pounds, and unfortunately, medications changed, and I gained about 10 back, but that'll go away. But the thing that really got me going with even finding out about a facelift were my eyes. I had a lot of really heavy and felt like it kept getting heavier and heavier, and I just wasn't seeing good. And so that was my journey, and I went to 2 other consultations locally, and then I saw Dr. Williams, and I got the most information, and I felt the most comfortable talking to Dr. Williams about what needed to be done. And the funny part was, I don't even know when it changed from just getting my eyes done to talking about getting my neck done and my face done. And so from like here down was my deep plain lip. And my entire life, I always had one of those chins that went like this, right? And every time I came to a stoplight and there was someone over here, I always did this because I was uncomfortable with myself. And I was teased as a child with, you have a big nose, And so when I came in and we started talking about everything, I was like, yeah, I want to get rid of this chin. And he showed me that computer-generated picture of myself. And he said, would you be happy with that? I'm like, yeah, I'd be happy with that, thinking there's no way he's going to be able to do that. And he did. And I've been like super, super pleased with it. My confidence level is like, went from here to here. It's really been a big impact in my life. And the funny part is, it's like probably a month or so after I had my surgery, I met a friend that I worked with, and I had just retired early to help my mom. And I said something about a facelift, and she's like, you don't need a facelift. You look great. And I started laughing. I'm like, I already just had one. And she's like, what? That's how, even though it was a dramatic difference, I mean, you saw the pictures, right? People didn't catch on. They thought retirement really did good for me. They thought, wow, you're well rested.
Yeah, I hear that every day. People, again, when surgery is done well, you don't see it. And people can't pick up on it. They just know, they just think you look great.
Yeah,
Yeah,
even my
so-
sister-in-laws, who I went to lunch with, I still had, pretty good incision mark down here. And they're like, oh my gosh, did you fall? And I was like, no, and I'm chuckling because they didn't understand. They're the ones that were saying, boy, you look well rested, So it's been a really amazing journey for me, my self-confidence. Just kind of elevate. I'm just comfortable in my own skin now, which I wasn't before. And the other thing is, when you're going through any kind of surgery, there's always something that, you hope for, like, you're gonna get the perfect thing, right? And, I have like a little bit of scarring back here and a little bit of numbness here. Would I do it again? In a heartbeat. Because it's nothing that is like, it doesn't impact my everyday life, If I feel like tight still here. And I just get a little
How long ago did we do the surgery?
3 years.
3 years, wow. Okay.
Yeah.
Well, people always ask me too, how long does it last, right? And so my answer, again, this deep plane left, I tell patients they're going to see results for 12, 15 years or so. If you have a twin sister, you're moved back on the conveyor belt, you're still going to continue to age. So in some sense, it's like indefinitely because your twin sister's always going to look, that much older than you. But usually I tell people they get a 12 or 15 kind of year impact on the result. So, but yeah, thanks for kind of sharing. I mean, it's interesting
Got any
to.
questions?
Yeah, I mean, it's
You look
interesting.
Thanks. Do I look well dressed? No.
Yeah, I think it's sometimes it's intimidating to come and talk. Right? It's a little.
Not me.
It wasn't. Sometimes it is. I mean, I think people they're nervous about talking about it and feel like they can't believe they're here. And the average person thinks about it for 2.5. I've heard patients tell me I've been thinking about it for 10 years. So there's no right time. You just got to know when that time is for you. So anyway, does anyone have any questions for Shelley, for me? And like I said, some people are shy, so I'll be around if you want to ask me in private or something like that, or even our patient concierge, Sarah, and Nicole, who have been here for many years, are very knowledgeable, so they can help you out as well. Yes?
You said your results should last about 12 to 15 years.
Yeah. You're going to continue to age, right? I mean,
Right.
like I tell people that the best in about 3 months, and then you start, aging.
Okay.
Now she's 3 years out.
And
so-
then 12 to 15 years later, if you're not, does that pulling of the skin and that level, would it make you age more after, like at 12 years, do you just go like?
No, so that's a good question. Basically, the way I do this is we're not burning any bridges. And I've been doing this long enough now, on a monthly basis. I have a number of patients that are mine that I did a lift on 20 years ago or 15 years ago. So it's not like all of a sudden just let something lets loose. It's just, you're just going to continue to age. When will you be back to that same spot? I don't know. That's what I tell people. I don't know, 15 years. So I don't know if that answers your question.
So
but
you
it's not-
basically just shift back to where you were.
Yeah.
But you still gain 12 to 15 years.
Yeah, that's what I was saying. Some answer could be indefinitely, because if you had a twin sister, you'd always look 10 to 12 years younger than her, but you're going to continue to age. It's just moving you back on that conveyor belt of aging, if you think of it that way.
There's one thing I do want to say. My experience here at the Williams Center, from day one, from making an appointment for a consult, through my consult, all the people that I have engaged with here has been amazing. I mean, they are outstanding. They really are. They're kind. They listen to you. They answer the phone. And if they don't answer the phone right away, you're going to get that call back. And I mean, through the surgery, I just felt well taken care of the entire time. And
We don't take that for granted. It was one of the reasons I left. I had an office in Memorial Hospital, and it just didn't have control of the care. So now we have, we can build a team around that. So it always makes me feel good when I hear that, but I'm glad you felt that.
yeah, definitely. And now I go down to the Rejuva Center and I give them a Botox once in a great while. And they're fantastic down there too. So your whole center here is amazing. Yeah.
Thank you, Michelle. Anyone have any questions for me or for Shelley?